As a friendly reminder, we are hosting the first of our two-part webinar series on belonging and public health in Canada today. Our webinar today is titled "The Foundation: Belonging as a Social Determinant of Health." I'm Jorge. I am the Director of Communities Building Belonging at the Tamarack Institute, and I am grateful to live to live, work, and play in the lands of the Kanien'kehá:ka Nation, very close to Tiohtià:ke, Montreal, and the community where I live is called St. Hubert. It's a very vibrant community that is very, very close to new communities that are in which we have many diverse communities joining us and living together. I'm grateful to see my community, the Latino community, but we also have many others, and we continue to learn through our connections to the land. We learn about the history from the communities that have been the stewards of the lands, in this case, the Kanien'kehá:ka Nation. And I am grateful as a newcomer and a settler also to continue to learn and also unlearn the told and the untold stories of the lands where we live in. And I also want to take a moment to share that we want to acknowledge those who came here as settlers, as migrants in this generation or in generations past, and those who came here involuntarily, particularly those who were brought to these lands as a result of the transatlantic slave trade and slavery. At Tamarack, this is really important because we have an ongoing commitment towards dismantling systemic anti-Black racism in communities that, as we all know, has resulted in several inequities for communities. So the conversation that we're holding today is the result of a deep exercise of listening and engaging with individuals from coast to coast to coast on what belonging looks like for them, what it feels like. And we observed last year that there's a deep connection between belonging and public health, belonging and well-being. And one question that we're holding for you today as we start our webinar is, what's one word or short phrase that comes to your mind when you think about the connection between belonging and health? What is one word or phrase that comes to your mind when you think about the connection between belonging and health? In my case, one word is justice, just recognizing that there have been inequities that have triggered this connection, have triggered polarization, loneliness, and have impacts on our mental health. We'd like to hear from you. So please share through the chat as we continue presenting today's topic, and we'll refer to those shortly. So as a friendly reminder, the strategy for belonging is the call for a movement that started in 2023. And the aspiration for a strategy for belonging is that we want to bring together cross-sector collaboration to share resources and expertise. We want to center everyone's voices. We want to shift the power to residents as co-creators of change and enable population-level change by encouraging municipalities to commit towards having a plan for building belonging and increasing the reported sense of belonging among individuals. The strategy for belonging has essential conditions that we identified in 2024. We engage with, as I mentioned, with communities from coast to coast to coast, and this is what we heard. It's important to steward power redistribution and democratic competences. Governments, organizations, and institutions have a role to play as facilitators, amplifiers, and connectors, and in assuming this role, it's critical to address power imbalances. We also want to find common ground, especially right now, and because reaching our goals for equity and accessibility requires that we meet people where they're at, understanding that individuals have unique skills and talents to bring. And last but not least, we need to inspire leadership. We need a new generation of leadership. A future of belonging is based upon our capacity to ground ourselves on leadership that is rooted in compassion, solidarity, and mutual care. In 2024, we observed that there are key themes. Again, this is the reason why we're having this series on public health and belonging. The first one is that belonging is a protective factor against poverty. We also heard that community-led storytelling can be so powerful in fostering connection. And the speakers will tell us a little bit more about this piece on storytelling and connection, especially those in part 2. We also heard that youth voices are critical for building belonging, as well as ensuring that our movement is grounded in the need for safe and affordable housing. Social infrastructure is essential in building belonging. It can help foster trust and cohesion. Belonging can help foster resilience and enable regeneration. It's not enough to talk in the climate context about mitigation and adaptation. We need to think about regeneration, given the damage that has been caused. And we also heard that community finance infrastructure is critical to strengthen the sustainability of projects. And related to the peace and leadership, building courageous collaborations requires understanding the role of governments and institutions and the role of residents, of co-creators of change instead of passive service recipients. And last but not least, without equity-centered collaboration, belonging can just risk of becoming something programmatic and not authentic enough. So we need to center equity in the work that we do. The last thing I'll mention before we introduce our speakers is that we are thankful to the over 1,000 individuals who signed the pledge for Strategy for Belonging. Right now, we are over 1,300. We hosted 8 workshops and webinars, 13 Circle of Actions communities participating in our first Belonging cohort last year, 5 community conversations, and 3 in-person conversations. We have the nonprofit sector represented in this Strategy for Belonging movement, governments, healthcare sector, community development, education, private sector, funders, and many others. We have representation from across most provinces and territories. And we have a working group that is coming up, and at the end of April, the first session on April 29, we'll look at leadership. What kind of leadership do we need to build belonging? We hope you can join us, because these are opportunities for us to co-create together the call for a strategy for belonging. So without further ado, I'm thrilled to welcome our 2 guest speakers today, Pemma Muzumdar and Nadha Hassen. Their bios are available on our website, so we're going to be sharing with you the link to our website soon in case you'd like to read their bios in detail. And for today's conversation, Pemma will set us up with some foundational thinking about what influences health, and also explore where the concept of belonging fits within the structural, the social and structural determinants of health. We'll then pass it over to Nadha, who will talk to us about some examples on how belonging can be fostered to promote public health, and how a lack of attention to belonging can create exclusion and inequities. So we're thrilled to welcome you, Pemma and Nadha. Over to you, Pemma.
Thank you so much, Jorge. I'm just going to try and share my screen here. And so while I do that, I'll just let everybody know that I love that question and I love your responses. And I find it so inspiring that I think that that's where I'd like to start as well. So I'd like to start by telling you a little bit about myself and what belonging means to me. I'll use a few more words than one, but still keep it fairly brief. So hopefully you can see my screen. I'm going to look to Jorge. Can you see the right screen right now?
I can.
Not the presenter notes. Great. Okay. So as you know, my name is Pemma. Jorge said that. And I wanted to also say that I use she, her pronouns. I'm an able-bodied woman. I have brown skin. You may be able to see that. And I was born in Toronto, Ontario. And my parents immigrated to Canada from India a few years before I was born. And these days, like Jorge, I live in Tshaka, also known as Montreal, on the unceded lands and waters of the Kanien'kehá:ka Nation. I live in a downtown Montreal neighborhood, and I'm saying that because I think it's sort of important to my story of belonging and what it means to me. I live between a higher income, predominantly white neighborhood with a lot of people who've come here from France looking to live in Montreal. And then on the other side, a high needs, extremely low income with high levels of substance use, many racialized people, area. So it's a mixed area. And I live near a few parks, a community center, a library, and a street with stores on it, a safe injection site, and a school. So all of that, again, is part of my story of belonging. And I have two kids. They're 3 and 6. And when my kids were younger and in diapers and feeding, I happened to be breastfeeding, I felt like I belonged when I went to places where there were change tables, when I went to places where there were places to feed quietly, or even just places to be with your kids when kids were welcome. And it was great when there was an affordable way to get to those places easily. It was great when I could have a ramp for my stroller. Those times that I felt like I belonged the most. And of course, that sense of belonging for me is different depending on what stage of my life I reflect on. But just right now, that's where it was sort of at for me. And so I feel that when I go somewhere and I meet people that recognize me and then they say, oh, I haven't seen you in a long time. Like, it's great to see you out and about. I feel like, okay, like I belong here. I'm part of this. I'm part of a community. And when I get invited to inform the decisions and the policies and the way things work in my community, I really feel like I have power and like I belong to the community and like I can contribute to the way things happen in the community. So for me, all of that takes us to a conversation on which really Jorge set us up so beautifully for, on the determinants of health, and I guess how belonging fits into all of that. So at the National Collaborating Center for Determinants of Health, where I work, we think of belonging we think of the determinants of health as having to do with belonging, but being more than belonging. So we describe them as the factors that influence the health of individuals, communities, and populations. And the determinants of health is a really broad concept. You may or may not have encountered it before in wherever you work and wherever you live. And so it also encompasses the concepts of the social determinants of health, which is another term that you might have heard, and the structural determinants of health. So if you want to know more about all those determinants and how they interact with each other, probably more than I can tell you in this time today, I encourage you to have a look at this resource because we do a pretty good job of it there. And I just want to give a big shout out to my co-author on this work, whose name is Jonathan Heller. I couldn't have really done it without him. So there'll be a link in the chat at some point that you can have a look at. So the social determinants of health, which I mentioned before, you may or may not have heard that term, have lots of descriptions associated with them. This particular description is from the World Health Organization, and it includes two distinct components. One is here highlighted in yellow. It's the conditions of daily life, and the other is highlighted in blue. Okay, so I was saying that Jonathan and I, we noticed that the list had all this sort of mix of different attributes: race, gender, ability, food security or insecurity, homelessness or housing. It was really a mix, like the way that they were framed and the whether or not housing was always included. It was very variable. So we thought that sort of reflected what's happened in policy and practice and programming and public health, that the concept of social determinants of health has really been taken up in ways that over-focuses on the conditions of daily life and doesn't ask necessarily enough attention about what shapes those conditions of daily life. And we liked this quotation from the WHO Conceptual Framework for Action on the Social Determinants of Health. It kind of gives that same warning. If you conflate those social determinants of health with the processes that lead to the unequal distribution in health outcomes, I'm sort of putting words in the quotation there, but if you mix those two things up, then you lose track of what's really driving those differential health outcomes, what's making it so that some people get to be healthy and others don't. Some people get to belong and others don't. And so I'm sort of skipping a little bit ahead here because I know I probably lost us time in that little technical blip. But in that resource, you'll also see that because of that over-focusing on the conditions of daily life in the descriptions of the social determinants of health that are out there, we wanted to draw a little bit more attention to those social processes and those forces and systems with a more explicit way of naming these structural determinants of health. And that term has been out there for a while. It's just been used differently and described differently. So we're offering this description up, and it's been appreciated. And if you like it, use it. And if you want to adapt it, go for it. And, be in touch with us about it. But we talked about the structural determinants of health as the written and unwritten rules that create and maintain patterns of advantage and disadvantage between socially constructed groups. So the patterns of advantage and disadvantage between, for example, people who describe themselves as cis women versus trans women, or the patterns of advantage and disadvantage between racialized people and white people, or multiple different identity sort of descriptors together. They're so thinking of intersectionality and thinking about, if you are looking at racialized trans women, what are the patterns of advantage and disadvantage when you compare to other groups? So we thought about those in the most simplest ways as the rules, the written and unwritten rules that create, maintain, or eliminate those patterns. And can't really think about those rules without thinking about power. Who has more power, who doesn't, and why? And that's a bigger conversation than we can probably get at fully here, but we start to get at it in this resource, and I can share some other resources in the chat if you want to explore a bit more. So the tree that Jorge was apparently going to start telling you about is here. It is not the only tree that exists. There are many other trees out there. But again, it might give you something to start thinking about within your organizations, communities, teams, to help make sense of how the structural and social determinants and other ecological factors fit together with different health outcomes. So we started with leaves on the tree, and we said, that the leaves would represent the examples of physical and mental health outcomes in communities and populations, and that the trunk would represent, for example, individual behaviors that contribute to health. And those behaviors are often the kind of focus or target of public health interventions. So we might look at substance use, or are you exercising enough? What's your diet like? But really, there's so much going on between the surface of the ground, between where this tree sits and that trunk and all of the soil. And so if you dig a little deeper, we depicted the roots as those conditions of daily life. So what we started to talk about at the beginning, which I could tell from your comments in the chat box, this is probably stuff you've been thinking about a lot, or are well familiar with. So these are often what come up in those social determinants of health lists: work, housing, networks and community, early child development, education, income, etc. And it's not a comprehensive list, but they're examples of those conditions of daily life. Then we thought even deeper. Okay, so what are some of the underlying values, worldviews, policies, practices that shape those conditions of daily life? And here it's really about those structural determinants of health. And you can see power here. You can see power relationships here, and you can see belonging. Pretty much in every one of these practices or worldviews, or ways of thinking, believing, doing, you can see who might be included and who might be pushed out, or excluded. So we happened to write about, in our soil, we happened to write about, slavery, and Jorge did a great job of talking about that in the Acknowledgement, transatlantic slavery and residential schools, thinking about the effect that that has had on Indigenous communities, on Black communities, thinking about the deeper sort of ways of thinking, the worldviews, colonialism, white supremacy, that underpin those histories and legacies. And then thinking about how that plays into institutional practices, like hiring practices, like the financialization of housing and who has access to housing. Thinking about resource exploitation, and not only resource exploitation, but where resources are most exploited. in which communities, thinking about tiered immigration. So your soil, for whatever work you're doing, might look slightly different. And you can use a blank version of the tree and you can brainstorm, the underlying causes, those unwritten and written rules that drive health outcomes that you're interested in. And you can think about belonging more specifically. But I see belonging here throughout all of these conditions and also throughout all those underlying drivers. And so in the resource, we put together for public health a list of, based on those conditions of daily life, but we think of these as a list of interrelated asset-based goals that we can all work towards together. And if you start there and you say, okay, well, how can we work together to get everyone to have supportive networks and a community that provides power and belonging for everyone? How can we work together for every child to have a happy and loving childhood environment? How can we work together to make sure everyone has decent, safe working conditions? Then you start to get into conversations about belonging. How do you make everybody feel like they belong in each one of these conditions? And I don't think you can have those conversations, I hinted at this before, without talking about power. Who has it and who doesn't? I'm going to point you towards a podcast that we have for a few examples that really do a better job than I could ever do of illustrating some of these aspects of belonging and that flip side to belonging, which is strategic exclusion. And so this quotation is from somebody named Camila, and she was part of they were part of an episode that we just did. It came out, I think, yesterday.
Very specifically and particularly excluded through systematic creation. It wasn't just a coincidence that these communities are equity seeking or deserve equity, because of a very particular agenda to leave populations out of being able to access power. And so I use that to try and speak to that history in a more concise way.
So I'm glad all of you heard that. So I was saying before, I don't know if I finished saying this, but we have this podcast and it's called Mind the Disruption. And it's stories of people who are disruptors and organizations that are doing work that is disruptive and disrupting the usual way of doing things, disrupting the status quo. And that gets at disrupting both those conditions of daily life and making them better, and disrupting also those underlying worldviews and ways of doing things and practices and values. So have a listen. I just pulled out a few quotations for you or excerpts for you that would help set us up for this conversation. I have one more that I'll share if we have time. I'm looking to Jorge. I think we do, but
yeah, we can do that. No worries.
Okay. So this one is from Diana Chan McNally, and she's talking about parks and public spaces, and I'll play it for you.
Thank you.
I often look at public parks, for example, it's public land. Public land should exist for the public good, but when we look at what a park is used for, look at the infrastructure. You've got playgrounds, you've got picnic tables, community gardens, baseball diamonds. All of these things are for recreation, or in the case of a community garden, you're growing food and you're going to cook it at home. That means you have housing. This infrastructure indicates who is welcome in that park. But why can't a public park be more? Why can't we talk to people who have to live in parks because we don't have the housing and won't have it, importantly, for a very long time, about what it is they need to survive?
So I think that's probably a good place to stop. And I will jump back into the conversation whenever I am needed. I have more things I can share, but I think we're good.
Thank you, Pemma. And I'll just say quickly, Diana joined us last year for our webinar on housing affordability and belonging. And she was one of the leading voices to help us really gain some insights on the connection between belonging and the housing crisis. So thank you. What an inspiring example. Nada, I know you have some thoughts to share with us about the work that you're doing with communities in the Greater Toronto area.
Yes, I will go ahead and share my slides. And Pemma, thank you so much for that great start and sort of like creating a foundation for us to talk about belonging as a social determinant of health. So just checking that you can also now see my full screen slides.
It works.
Amazing, thank you. So hello everyone, and thank you so much to Jorge, Jaime, and everyone for inviting me to speak with you all today. My name is Nadha Hassen, and so I'm just going to be building off of what Pemma shared by sharing a couple of the examples from my work around belonging, social connection, and particularly as it relates to cities and communities and the environments around us. And hopefully that'll spark some questions and ideas. Okay, and so very quickly, I'm in Toronto, which is where this work took place on Treaty 13 land. I am an immigrant and a settler. I came to this land when I was a young adult, and I've been here for about 17 years now. And I'm truly grateful to call this land home, and echoing what Jorge and Pemma have mentioned about unlearning what that means and the stories that have been shared, false stories, and learning what is true and what is meaningful and how we work towards meaningful reconciliation. And so I'm sharing a couple of examples, and my work really bridges research and action at the intersections of public health and also environmental studies and the built environment. So what does equity look like across different spaces and places? And so I did want to sort of zoom out and think about this idea about how cities and places are really influenced by notions of who belongs where and who has access to what resources. And we really saw that come through in what Pemma and Jorge shared earlier. And so this is a recent project that was done in collaboration with the Bentway in Toronto, which some of you may know, and which focuses on the space under Toronto's Gardiner Expressway. And so this is really a growing public space, and there's a long history behind how this came to be, which I won't get into today, but with partnerships with the City of Toronto as well. And so we recently published this report in February on prescription for social connection. And so last year, I collaborated with the Bentway and Gel Studio and some other great folks at Dalalana to explore this public space and understand impacts on social connection, loneliness, and sense of belonging. And so this was in response to the Toronto Foundation's Vital Signs report that named Toronto the loneliest city in Canada. It's interesting because I'll always hear in the conversation between Toronto and Montreal how people say that Montreal is so much more connected than Toronto. And so this is alarming because the data really showed that 43% of Torontonians report never seeing their neighbors, 37% report feeling lonely at least 3 days of the week. And this is alarming because it's actually a trend that's happening in cities everywhere, and really a growing crisis. And so one of the questions here, and the response was, the spoiler alert, is that really we do think that public spaces are a critical social infrastructure to foster social connectedness and a sense of belonging. And so the question we were really hoping to answer here was, what role does public space play in fostering social connection and combating loneliness? And a couple of our survey questions specifically asked about belonging. There were multiple components to this report, and hopefully maybe we can share that in the chat. But the part that I was involved in was really on this public health survey. And we had 6th grade graduate students join us to conduct in-person surveys on site to really understand what people felt and experienced and thought about this public space. And so that's a picture of, you can see underneath the Bentway, and the highway is right over that. And so from about 365 respondents, we heard that spending time at this site made them feel healthier and more connected. So 71% said the site positively impacted their physical health. But 64% actually said that it enhanced their sense of social connection, and 59% said that it improved their sense of belonging or their sense of community. And we also heard some great stories from people who met strangers at the site and then continued to meet up on weekends to skate together or to just hang out. And so this question, I think that we can ask in terms of how do we move forward and how do we create spaces that are connected, is how do we also think about reclaiming unused spaces, but spaces that are used for certain functions, and how do we make them available to as many people as possible? And so if we're thinking, whether it be public spaces or if any other ways that we're thinking about promoting belonging, I think if we have to really be explicit and provide explicit invitations to signal to people that you matter and promote that connectedness. When it comes to the built environment, there's certain physical features that we heard can support this. So key design features, if you see on the top left of the screen, we heard from folks, 71% said that public seating supported meaningful interactions, which makes sense intuitively and is cost effective and an easy way to support better public spaces. There needs to be a will, there needs to be investment, obviously. But why do we often not provide these critical pieces of infrastructure around spaces? And so I think we heard from some of the quotes that Pemma also shared, that these are also intentional in terms of how we design our environments to keep certain people out and keep other people in. Landscaping was another big one. So greenery, this connection to nature, was something that we heard. More than half of folks said that this actually felt like they had a sense of connection and belonging to the place. Art invites interactions, and so programming spaces, making them intentional, was a key finding. And finally, lighting, so important for safety. We heard that time and time again, especially when we have shorter daylight hours for so much of the year. And some of this is not new, but some of this is also when we're asked for evidence around how we can invest, it's helpful to start to put this forward into the conversation. And so there is a lot going on in the world right now, but a sense of connection is a constant need for all of us. And so this report, we really put it out as a call to action to think about how we can support these critical spaces. So I also want to just spend a few minutes talking about the Park Perceptions and Racialized Realities project as an example of how we can delve deeper into thinking a little bit more critically about belonging and equity and some of those structural determinants of health. And this project focused on examining the social and health equity in public green spaces in underserved neighborhoods in Toronto. And so, like we've heard, social access to green space is fraught when it comes to who belongs, who can use these. And so in Toronto and in many, many cities across North America and the world, neighborhoods are divided along income and racial lines. And Pemma, also, you did such a beautiful job of illustrating where you're situated as well. And so these existing inequities really were exacerbated during the pandemic, including for racialized communities. And this was the time that we actually conducted this project that I did as part of my doctoral research. So I'm not going to get into depth here. I just want to say very quickly that this was a community-based participatory research project that took place with two community organizations, the St. Jamestown Community Co-op in St. Jamestown and Jane Finch Center in Jane and Finch. And both these neighborhoods, for those of you who may not know, are racialized neighborhoods. They're vibrant neighborhoods. They're also considered underserved, and there are significant differences in the amount of green space. So St. Jamestown is located in the downtown Toronto core, and Jane and Finch is in the northwest of Toronto with greater amounts of green space. And you can sort of see that on the map here. But they have different issues around access and being and feeling like welcoming spaces. And we really did want to root this in feminist and anti-racist principles. And so I wanted to share in my time with you a few photographs to really illustrate some of these deeper issues that we're trying to get at. So this was a photograph by Nathan, and he called this one Neglecting Diverse People. And he said, and I quote, "This green space is utilized by diverse people living in the neighborhood, and the bare minimum facilities in the space gives a feeling of neglect of such people." And so really this project was a way for us to start to talk. It was an entry point into how to discuss broader issues and structural factors here, and really how intersectional identities came to the forefront and how can we sort of visibilize. So we used an adapted photovoice method here to really see what residents were experiencing. So Aissatou identifies as a Black Muslim woman, and she took this photograph to depict, quote, "the brighter side of Jane and Finch," saying, "We're not poor, it's not a ghetto, it's not dirty. People in the community could be viewed as teachers, as lawyers, as athletes." And we heard a lot about how certain neighborhoods and communities are negatively portrayed and stereotyped. And folks, and Aissatou said that she feels happy in her neighborhood and she feels like she belongs. And so this really came through from a lot of the residents. So this project resulted in over 200 photographs and videos. And so we actually did a collaborative analysis with residents, and they identified these themes. And I really loved, Jorge, how you pointed out how community-led storytelling is such an important part of the work that we do. And so I will highlight here that actually two of the themes that came forward were belonging and social connection and exclusion, two sides of a coin. And so the community report is publicly available. If you're interested in it, we can put the link in the chat, and I won't get into sort of all the details and the recommendations, but I did want to highlight a few more key ideas. Are we doing okay for time, Jorge? I'll wrap it up soon.
Yeah, maybe like 1-2 more minutes.
Sounds good.
Thank you.
So Amita here, and I think this really illustrates a key idea. So she said, "When I go outside, I see people that look like me. People leave me alone. They don't try to say something inappropriate. There's a lot that's tailored to me and my identity here, whereas I don't really think it's the same if I were to leave. I know a lot of the resources, the people that work in them, they're friendly, they're nice and welcoming, and that's why I feel like I belong. They sell things from my culture here. I grew up here, so I feel connected." And so here I just wanted to point out that while 2/3 of the residents said that they felt like they belonged in their neighborhood, there were several structural barriers that diminished this. And this quote by Nathan actually points out how he finds himself to be quite isolated, because you can feel a sense of belonging to a physical place, but you may not feel like you belong to people. You may not have the interactions, they may not be on the heart level. And I'm speaking after 5 years, also because people are moving in and out of St. Jamestown. And this speaks to, again, what does displacement look like? What does it mean for people to not be able to root in place because of financial barriers, because of needing quote unquote Canadian experience to work in this country, etc. And so overall, this really highlighted the importance of naming structural and systemic issues and taking a strengths-based approach to really understanding community voices, and also the importance of creating those generative spaces for anti-racist dialogue with racialized communities and also other equity-deserving communities. And so we actually talked in the report, there was a call to increase social connection. That's something that a lot of residents wanted. And we talked about cues of belonging. So, you know, what does it mean to maybe translate street signs into multiple languages? Or what does it mean to sort of think about how our space can signify that we belong? And this was a recent paper that shared some of these findings on narratives of exclusion and justice. And so, Jorge, your word was justice, and I think that that's an important piece here. But really what I will highlight here is that the residents had nuanced experiences. They experienced very sometimes invisible cues of exclusion through signs that said that they don't belong, or lack of infrastructure, or lack of maintenance. And they also really highlighted how structural and systemic forces can result in these complicated dynamics, not just in green spaces, but public spaces, indoor spaces, all the areas that we convene and connect with each other. And so I'll end with this, which is really we put forward these principles, and maybe I'll share that, as part of this strategy for belonging that Tamarack Institute is also doing a wonderful job on, is really how can we commit and recommit to principles of anti-racism, equity, consider intersectionality, recognize the complexity of experiences where we're not homogenous communities. Even one particular community is not by any means have the same experiences, to really ensure meaningful community engagement in terms of not being tokenistic, not being performative. What does that look like in reciprocal relationship? And how do we take collaborative action alongside communities? I will stop us there. Just wanted to quickly acknowledge the wonderful folks who were involved in this project as well. Thank you.
Thank you so much, Nadha, and thank you, Pemma, as well, for sharing your reflections with us today. I'm really conscious of time, so I'll pass it over to you, Jaime, for the Q&A portion of our conversation today, before we share some important announcements with you.
Sure, happy to help. So while we have been chatting, there's also a lot of conversation that's happening in the chat. Right now we're talking about strategies for measuring belonging and what those indicators might be. We're also seeing questions pop up in the Q&A box about enhancement in green spaces through increased vegetation cover, lower temperatures, and reduced noise pollution that have all been used to promote both physical and mental health. So Sherry is asking, are there nature connections that can support those who are currently experiencing loneliness and or in seniors' homes to disrupting the underlying worldviews of aging communities? So that is a nuanced question, but we're specifically talking about like senior communities or people who otherwise might be experiencing isolation and loneliness, and potential interventions that might promote access to nature. Is that something that, Nadha, you've seen anywhere in what you've been studying?
It's a really big question, but it's also a very important one. And I think, and I will say that there's a lot of work that is starting to be done with older adult communities and understanding that. I know that there's someone I know at the University of Toronto, another postdoctoral fellow who, Dr. Peggy G, who also does work in around aging environments and like what does that look like for us to create spaces and communities for everyone to be involved. I know that there's a couple of questions in there, and in the interest of time, I will say that I'm happy to continue the conversation with folks elsewhere if that makes sense. But yeah, that's a very quick answer.
No, I appreciate that. I'm also seeing Greg asking a question about the differences in rural versus urban environments, or different communities. The examples you gave were obviously very Toronto focused. Have you ever seen any of these interventions or similar interventions be applied in a more rural or smaller municipality setting?
Short answer is yes. There are folks doing incredible work. This was obviously very, very urban focused, but Jorge and Pemma, I'm not sure if you wanted to add to that.
I can share that last year through the Circle of Actions cohort, the cohort on developing plans and interventions for belonging, we had small and mid-sized cities actually taking leadership on doing this work. One of them did a beautiful community mural in an area that was experiencing isolation. And just urban blight. So there are definitely stories, and this year's cohort is also elevating some of these stories of the work that communities are doing. And in fact, for part 2 of the webinar series, we will have a cohort community presenting their work on public health and belonging. It's quite inspiring. And it's not precisely a big city, it's a small, mid-sized community.
That's awesome. I'm seeing another question from Matthew, specifically asking about the Bentway research project and asking whether the data was disaggregated, so by race, gender, immigration, status, age, or ability. He was interested in hearing from the panelists who are accessing, or like who is actually accessing these spaces, and whether they might not unintentionally replicate or reinforce the same inequities that we see in other areas of social life.
I appreciate the question. I think it's really important. We did collect demographic data, and I think that this also in a part of a bigger conversation is why I like to present both these projects together, is to understand that certain spaces too are sort of like destination spaces, and other spaces need to be, we need to think about the local, like what's right outside in our neighborhoods, like outside our front doors or in our areas. And I will say that with this, we had the disaggregated data. And one of the things that we also noticed is because of the type of programming, that I think it was also skewed based on the days that we collected data. So for instance, data was collected on one day where we had a massive yoga with Adrian event. And I think that that also skewed towards able-bodied, cis women. And so like, again, those are things that absolutely need to be taken into consideration, and why I think it's absolutely important to have community engaged research with and alongside communities who are equity deserving, to sort of start to understand how can we get a fuller, bigger picture and not reproduce structural issues. And I think I saw a question there, and I will say that and that brought attention to how this research was done, the Park Perceptions project. And so happy to chat about that afterwards as well, because we collaborated with community organizations, but then also brought the residents in to really lead and move forward the work.
Thank you, Nadha. I want to apologize one thing for clarity. It's actually a mid-sized community that is presenting next week, so I shouldn't have said small. But we do have stories in the Tamarack website on a lot of place-based partnerships in communities of all sizes, all locations. So this work is possible.
Absolutely. Jorge, do we have time for one more question?
Sure. 2 more minutes for another question.
Okay, this will be a fast one. I see somebody, Michelle specifically asking, so there's a gradient of increasing sense of community belonging with age. What can we do to learn from older populations to improve community belonging in younger populations? Does anyone want to weigh in on this?
Join next week's webinar. That's long story short.
That is a great way to address that very, very quickly. Jorge, my mind went to Gil Panalosa and 880 Cities initiative, that cities that work for 8-year-olds and 80-year-olds will work for everybody. And I love seeing those links between, young and old, and what can be learned from both. I'm going to drop a link to next week's webinar, which is the more action and implementation focused part of this work. I'm going to drop that in the chat now, and I'm going to hand the mic back to Jorge.
Thank you, Jaime. And this is a perfect segue into the next portion of our conversation today. Just a reminder, Jaime is going to be sharing with you the link to part 2 of our webinar series next week. We have Shayna and Abigail, who will be presenting the work that they're doing at the Tri-Cities partnership for actually intergenerational belonging. So it's really exciting. They're going to share with us about the work that they're doing, bringing together not only healthcare practitioners, but also residents, individuals with living experience, youth, city councilors, and many other individuals in their community to actually do something around building belonging. We also have a community of practice conversations at Tamarack. or community of practices or communities of practice on belonging are open to all of you. We have the community safety community of practice conversation on April 30th with our partners at the Canadian Center for Safer Communities. And we also have a community of practice on neighborhood learning, in which, just to Nadha's points, we have a growing community of practitioners that are thinking about social infrastructure for belonging. So what does it take to build next generation social infrastructure that builds human connections and connection to our planet as well? So without further ado, we just want to share with you these final slides for you to, as always, we're open to connect with you. We have different platforms, and we hope we can continue the conversation. I'm conscious of time, so we'll leave it there for now. And we're really grateful for your involvement, your care, your commitment to this work, and we hope to see you next time and see you next week.